Dr. Upson, today with temperatures in Washington in the mid-90s and a code orange air quality alert, we obviously have high air pollution concentrations that may become unhealthy for sensitive groups like people with asthma. I've received from many of my constituents in Albuquerque saying, and I want to quote a couple of these. My son is one of the 47,000 New Mexico children with asthma. He especially needs pollution-free, clean air. Another Albuquerque resident, please continue making every effort to protect environmental legislation. Sincerely, someone with asthma. Another from the northwest part of our state, my husband is an asthmatic and support for the current law really affects us. Thank you for your work. And then finally, one says, and they wanted to post this to you, Dear Senator Udall, I've lived with the real-life effects of air pollution as a mother. It's difficult to witness your child struggle with asthma and feel like there is nothing that you can do because there are millions of children around the country like my child in need of cleaner air. I ask, is pollution from industrial sources like power plants, do they place my children at risk of asthma attacks? What's your response to these kinds of questions from mothers across America?
So the question is the contribution of pollution to asthma attacks?
Yes.
I think the evidence for that is unequivocal, and I don't think anybody disputes that air pollution causes asthma attacks. I had asthma, I still have asthma, and as a child growing up outside of Buffalo, New York, when the steel plants were, in full gear, there were nights when I was maybe 8 or 9 years old, and I would lie in bed struggling just to get every breath, and I was afraid to go to sleep because I thought that I would die if I wasn't using every ounce of energy I had to breathe. So I know what those mothers are talking about. I see it in children of friends, and certainly, of course, in adults with COPD. I see the same things.
Yeah. Now, one of the witnesses, Dr. Goodman, used this statement, I'm not suggesting that air pollutants do not cause harm at high concentrations. Studies have shown they consistently do, but the point here is that in our communities right now, like this high alert here and like what's happening in New Mexico with the wildfire pollution that's coming over from Arizona, the levels that we're talking about today make a real impact on lungs and have a definite impact on more vulnerable populations. Isn't that correct?
That's correct, sir.
Thank you.